Behcets Disease is basically an autoimmune disease, and that means that the body thinks that there's something wrong, and it sends out antibodies to fight certain aspects of your body. Most popular of the known diseases are Crohn's, lupus, rheumatoid arthritis. Rheumatoid arthritis is your immune system attacking the joints. Lupus, your organs. Crohn's, your GI tract. Behcets, unfortunately, is the immune system thinks everything is wrong with my body on a cellular level. So it attacks the joints just like rheumatoid arthritis. It's going to attack my organs just like lupus. And there's no cure, there's no treatment, because it only affects men in Middle Eastern countries primarily. In the US, there's only 1,400 known documented cases of Behcets. That's rare enough. Unfortunately, I've been diagnosed with neuro-Behcets, which means that not only are the organs, the joints, everything about my body being affected, it also affects my lower neurological system. So I suffer from seizures, I suffer, with nerve damage and so forth. So it's actually 10% of documented cases are actually neuro-Behcets. So I'm one of 140 in the United States with this disease. When episodes happen with Behcets, we call them flares. When a flare occurs, it's sort of like when a normal person feels when they're getting the flu. You just kind of feel achy and malaised and just tired, and you're not sure what hurts the most. You just kind of feel yucky. And as that progresses, the symptoms of Behcets are what the signs that they look for in order to even diagnose the disease, because there's no blood tests, there's no x-ray, there's no, specialized anything that says you have Behcets disease. It's based on symptoms. And those symptoms are you have eye inflammation or uveitis, which is when the blood vessels in the eyes become so inflamed that they actually extend and embed themselves in your cornea. And then when the flare's over and that inflammation recedes or swelling recedes, it actually tears at the cornea. And that's what brought the diagnosis on, was the fact that I had lost vision just on that symptom alone. And it usually at some point you end up having to have corneal transplants even. Another symptom of Behcets is the ulcerations, sores. You get them orally, you get them in private areas, skin lesions. Basically, when the blood vessels become inflamed or swollen, they rupture and break, and it causes sores. And when I say sore, I mean everyone gets a little canker here and there. You know how painful that is. It's hard to eat, it's hard to drink. The sores that I carry number in the hundreds in my mouth. They literally eat through the skin. I have them on my tongue, in the back of my throat, and they go through my esophagus and actually internally all the way through my GI tract, which causes the inflammation of that particular area. The skin lesions are everywhere. So for me, when I flare, I start aching all over, and then the sores come, and then the inflammation of the joints, the muscles, the organs. So when I have a headache, it's not a headache. It's actually documented inflammation of the blood vessels in my head. My heart is inflamed and fluid surrounds it. I have difficulty, even keeping food in, let alone the attempt to eat and talk. With the vision problems, light sensitivity. And so there was once upon a time, flares would only last 3 or 4 days. I'd be in bed, no big deal. And then we had probably a good 7 years of it was bad. And then I had a 3.5-year remission. How that happened, God only knows. I had this horrible, my husband hated it, where I would document every day how I felt. And if I said good, that would probably be you going and meeting the president, okay? But we moved to Orlando, and I felt like here I am, I've got, a great husband. His job brought us here from Tampa. I'm originally from Birmingham, Alabama, so you might pick up the accent a little bit, but I'm proud of my football team. But we moved to Orlando, and I was very frustrated because it's like, you know, I wanted a new start, a new opportunity, and I literally, my husband and I and my children put our faith in God and said, you know, do something, Lord, you just got to do something. And in that process, I noticed that I was having a lot of more good writings in that calendar than I had bad. And so we took the opportunity to just have faith, and I weaned myself off the medications that I was on at the time. And from that moment on, it was 3.5 years of nothing but Flintstone vitamins and living life. And we thought we beat it. We thought, all right, God, you got this, and we lived life, and I mean to the fullest. You know, it's difficult when you're a mom and a wife because with this disease, because you never know when a flare is going to happen. You never know the severity of that flare. And, you know, before this remission, yes, there were times I was in the hospital, but the kids were so young that they really couldn't grasp the concept that mom wasn't around, grandma would come fill in, and you know, we didn't get into the details. So when that 3.5 year remission came, it was like, we're living life. And sadly, in 2007, the disease came back. And that very first flare, I found myself in Florida hospital and organs failing. And doctors coming in and saying, we're in trouble, and their first thought is chemotherapy. We've got to kill her immune system. We've got to stop this. And you can only imagine not so much fear. I mean, of course you're fearful. You know, someone's coming in saying your life is being threatened and you need to get things in order. And everyone's trying to rush around to find someone who knows this disease called Behcets, because nobody did. And every doctor we would call would be like, you know, I think I might have heard that first year pre-med, not sure, I don't know. Or if they did know, they were like, oh no, we are not coming anywhere near this lady. This is very rare disease, a very complicated disease. There's not enough information out there. And they just would like send her to Jacksonville, send her to Mayo, Cleveland Clinic, anywhere. You know, they just were not prepared for me. But it wasn't until I came here to Winter Park Hospital that changed, because people saw me as a human being. I was no longer a Behcets patient who's rare. I was no longer file number, blah, 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 blah. I was a human being who was in desperate need of help. And I found a hospital who employed everyone from doctors, nurses, hospitalists, to environmental services, to the incredible women who brought me food I couldn't eat sometimes, that said, you know what, she's a human being, and whatever this is, it's bad. And they saw a wife and a mother and a sister and an aunt and a cousin and a friend and a youth leader and somebody who was going to fight, and they were willing to fight with me. And that was 5 years ago, and I'm still fighting, but I'm not fighting alone. And it is that's what gets you through it. When I wake up and I start feeling achy and that first sore pops up, I think anybody would be like, okay, this is just, I can't do this anymore. There's been over 30 admissions to this hospital in 5 years. That's just admissions. That's not flares, that's admissions. And the average admission is 30 days. Shortest has been 12 days, longest has been 7.5 weeks. I've got doctors who won't let me quit. They know that even though it's hard to see that I'm a disabled person with a life-threatening chronic illness, that it's a situation that, regardless of its rarity, regardless of its complication, that I've built relationships in these 5 years that when I get admitted, and I'm usually moved to the same unit, which would be the specialty care unit with oncology, is primarily where the majority of my stays have been. And because of the care that I got and the opportunity for these nurses to come in and know me as a human being, as a person, as Bridgette Marriott, someone who's the wife of Scott and the mother to Brittany and Lauren and Sarah, they've taken the time to come in and go, how do you do it? And what can I do to help? And, treating us like we're family, literally like we're family. And for me, it made it easier when my family would leave at the end of the day to say goodbye to them, because one, I knew I was in good hands and I was going to be taken care of, and I knew that they were secure in the thought that I was in good hands and that I was going to be taken care of. So I knew that they could go home to their lives, my husband to his work, my kids to their school, their friends, their lives, and their life could go on. And I didn't feel bad. I felt bad because I wasn't there. But I also knew that I had a group of people around me that were praying for me, that were lifting me up, keeping me encouraged, keeping me wanting to fight. Because that's the core of this disease, is you've got to be willing to fight to get through it. Because there's no avoiding it. There's no, I pray that there'll be a day for another remission. I pray that there's someone out there that has the mindset to go, there's got to be something that can help her. We've not had a lot of success treatment-wise. We've tried everything from chemotherapy to all the drugs that are manufactured for every other autoimmune drug out there. With something so rare that affects so few people. Obviously, I'll be honest, if I won the Florida lottery today, it would go towards heart patients or cancer patients, the diseases that affect the most amount of people. And I understand that concept. So for us, it's not that we pray for a cure or pray for a treatment. We just pray that we get through the next one. And we do it leaving an impression on those around us that no matter how big the mountain is or how hard it looks to get up and around it, that with love and support of your family and friends and most importantly, your faith, and being in a place that you feel safe. And that's what Winter Park Hospital has become for us. It's my safe place. I know that if I have a bad day and I'm crying, my nurse is going to stop and she's going to put her arms around me and tell me I'm going to be okay. She's going to pray. When they say they pray for me, I know they're going to pray for me. To be in a place that I can share my faith. The last admission I had to be in a new unit because the specialty care unit was full. And I was kind of panicked about that because I'm like, SCU, I know those guys, they know me. They've seen my daughter come in her prom dress because I missed prom. They saw her come in her cap and gown because I missed graduation. They've seen me celebrate birthdays and anniversaries and Valentine's Days and Thanksgivings. No Christmases. I was admitted in November and was here 30 days and got out 3 days before Christmas. And that was the closest we've been to not getting Christmas, but I was home for Christmas. But this latest admission, coming off that elevator and going, wait a second, where are you taking me? I was like, you could feel the heart just go a little bit and the panic, and I'm looking at my husband going, oh no, please, not somewhere new. But I'm so grateful. I'm so grateful because it gave me an opportunity to know now that it's not just SCU Winter Park that's on my cell phone speed dial. It's Winter Park Hospital overall, because I see now that the care I received in SCU for 4 years is the same care I'm going to get anywhere in this hospital. It doesn't matter if it's, which the unit was the PSCU unit, but and it was new environmental services and new food service ladies, but it was the same loving of a human being that I received in that new unit. And what made it even more special that I didn't even realize was the worry that I had that, oh my goodness, every 12 hours I'm going to have to go. It's not Behcets, it's not Behcets, it's Behcets. And go into the details of what Behcets is and how it affects my body and why I have such a high tolerance for pain medication and why I have gone through 4 rounds of chemotherapy. And because they look at you and basically see sores and they hear that you're in pain, but I'm not bald. I'm not missing a limb. I'm not having a heart machine pump my heart for me. I don't have a lung machine pumping air for me. So to most people, why are you here? And I've been in hospitals. I've seen doctors and nurses that have come in and go, why are you here? You can't possibly be in that much pain. This disease can't be that bad. But not here, not at Winter Park. There's been times, of course, people want to know more, or a lot of times now they just, before shift starts, they go to Google and, but you have to understand that when I was diagnosed, Behcets wasn't a blip on a map anywhere. In fact, the U.S. government didn't even have it listed as a viable disease in which you could be disabled from. Because of me and 2.5 years of fighting and proving my case, it is now in a book in which the government even recognizes it as a viable disease. Because Middle Eastern, man, not me. Not me. So, it's been a journey. It's still a journey. It's an ongoing journey. Some days are good, some days are bad. But it's all made me who I am and who my children are and what my relationship is with my husband. And most importantly, my relationship with God. Sorry. I try to tell people, no matter what you're facing, no matter what struggles, whether it was my 17-year-old daughter with an English test last night, to mourning a child, you're not alone. And I think that's the core of this hospital, is that I saw a nurse, didn't know her name, didn't know her position. She came in my room, made sure I was getting set up for admission. And I just knew something was bothering her. And I asked her if she was okay. And of course, being a professional, she's more concerned about me. And I just asked her, could I pray for her? And she said, yeah. And proceeded to walk out of my room. I'm like, no, I don't do it that way. And I prayed with her. And I didn't need to know what it was about. Because God knew. Because God knows what I need and when I need it. And sometimes it's a nurse, or it was this precious woman that came in my room every day and cleaned my room, that never failed to say, I'm praying for you. Or they put their arm around you and pray with you. And I had that experience the very first time I was admitted here. And I experienced it 2 weeks ago when I was discharged. And I'll face every fear with this disease, knowing that God placed me here, not to just get the physical pain to go away, which it never really does, but to help others pour into me so I can pour into others. So if there's a plan and a purpose that comes with Romans 8:28, Behcets is my plan and my purpose. Have I asked him to take it away? Sure. I think it's human. It's human. But I know now that when someone hears about it or knows I'm in the hospital and they go, how do you do it? It's God and my family and my friends in this hospital. And that's how I do it.